Hey, how's it going? Today I wanted to share with you guys a case that I've been working on recently, and this is something that, I've been doing this for over a decade now, and to be honest with you, I kind of get desensitized to things, and so my team asked me to share this patient's experience, and so I just wanted to kind of go through and just share what was going on. So this is a younger patient. I think she's 22, 23 years old. Came to me back in end of November, and here's just a picture of her lumbar spine from the front. You can probably, you don't have to be an expert in X-ray here to realize this, but this is her back being super twisted up. Her pelvis is on level, and her lumbar spine is bent to the right side pretty substantially. And so she came in with quite a bit of pain, obviously kind of deformed or disfigured in a way, manner of speaking, just basically kind of hunched over to the side. And she, of course, had had several different uh, injections and pain pills given to her and recommended for spinal surgery. And long story short is this is kind of the standard process, right? This is kind of the traditional route. The traditional route is you start off, if you have a back problem like this, you can, go do some stretches and exercises like physical therapy. Occasionally you'll get recommended someone to kind of pop your back, trying to line it back up in a way. But after physical therapy and whatnot, your standard recommendations are basically muscle relaxers, pain pills, that type of thing, injections. Um, and then kind of finally you have spinal surgery on the table, and that's kind of about the size of it. The final option is you could just otherwise just live with it if you don't want to have spinal surgery. So anyway, so this patient, she had kind of done all that. She'd been to kind of the standard old school chiropractor where they basically just kind of pop your back, kind of hope for the best. um, and she basically, I think, friend or colleague or someone had basically said, "Hey, why don't you go check out these guys over at Tallahassee Spinal Care?" So she came to us kind of at the end of her rope as is like a 20 something year old kid, basically with a pretty substantial amount of pain that just was not going away. So anyway, most of her pain was, of course, in her lower back, and this is kind of how she presented to us. And this is kind of her presenting to us after things had gotten a little bit better, right? From like stretches and exercises and PT and whatnot. And so anyway, long story short is, when we see patients like this, everybody kind of gets locked in on where the pain's at. All of her pain was in her back, going down into her legs. Um, and so I actually did imaging from the patient's, head and neck down her back, did measurements, orthopedic tests, all sorts of different testing and measurements, basically from top to bottom. And interestingly enough, in her particular case, I found out her root structural issue was coming from the top of her neck. Right where her head and her neck meet, it was kinked in a way that was actually causing this chain reaction all the way down her spine. And she had some damage to the connective tissue and the discs in her back as well, among other things. So there's couple components at play here. But as far as just looking at how bent out of shape she was, this was actually coming from her neck. So this entire time, she's had pain basically in her back and her legs. Everybody's been focused on where the pain is, but her root problem's been somewhere completely different the entire time. And that's ultimately just, I'll say, the reason why things didn't go the way that she wanted them to. I mean, at the end of the day, if you're treating a symptom and you're not actually solving the root issue, inevitably you can get a massage, you can get your back popped, you can get injections and do all this different stuff, but it's just going to come basically right back, right? Like it may help a little bit, but ultimately it's just going to be kind of back to square one. So anyway, long story short, found out this issue in her neck, basically straightened that out, and then this is an image of her back from a couple days ago. So for me, like I said, I kind of get desensitized to this thing. I see it all the time, but this is after a couple months of basically getting her straightened out. How many times did I basically adjust her lower back? Zero. Not once. Not once did I do anything with her lower back as far as to straighten her out, because the problem wasn't really there. The symptom was there. The issue is the side issue is there. But I guess all I have to say is, and the reason I'm really sharing all this is, it's not like any of the providers that she saw beforehand were bad people, and it's not like that they were incompetent or anything like that. But sometimes, sometimes your problems are elsewhere, and cases are more complex than just where the pain's at. And so I really just wanted to share this because most people, almost all the people I work with, kind of share a similar story as this patient. Basically, they've been struggling with a problem. They've been given pain meds or doing stretches and exercises, basically things that their insurance company is willing to pay for. But ultimately, it's kind of just pain management in a manner of speaking. And so, anyway, in our clinic, I've kind of built my life on trying to give people options, give people the ability to try something differently. That's really all it is. Not everybody that comes in my clinic gets fixed. Not everybody that comes to me is someone that I can help. And but ultimately, when you're struggling with some kind of a health crisis, when things hit the fan and life's not going very well, really what you need somebody that can kind of like guide you and be like, hey man, I'm going to help you figure this out. Whether we can help you or not, I'm going to get you to the right person. That's really what you want. You want someone who's going to like not just do one or two tests and write you a prescription. You want someone who's going to basically try to figure out what the root issue is and basically straighten it out. And so, anyway, I'm just, like I said, I'm really the purpose behind this video is just awareness, really more than anything. If you're struggling with problems, or you have a friend or family member who's been struggling with an issue for a long, long time, and they've tried all this stuff and they're discouraged, sometimes you just got to have someone look at it from a different angle with a trained eye and maybe with the technology to analyze it, and that can make all the difference in the world. For this patient, it did. She wasn't able to work. Of course, in her condition, she was in too much pain. Now she's starting a new job and is excited to get back to living like a normal human being. And yeah, I mean, I think it's reasonably fair to say, after she had dealt with this problem for I think like a year, that now she's on a path to feel better to some degree for the rest of her life, because someone sent her over for us to get eyes on her case. So anyway, I hope this is interesting to you guys. I'm always happy to post some more cases, but I thought this one was kind of fun, just to, on the back end, right? It's kind of fun for me to see the change from the pre to the post. But yeah, so this was February 17th, so this was yesterday when we took this image. So anyway, hope you guys enjoyed it.